Previously on Sengkang Anatomy. Stop the bleeding, now! I'm not losing him! Okay, do you have any pain doing that? You have ruptured your ACL and therefore we need to reconstruct this. This is my reality. Hi, I'm Dr. Hamid Razak, age 35, and I'm an orthopedic surgeon. The word orthopedic surgery comes from two Greek words. Orthos means making straight, and pedia refers to children. Traditionally, orthopedic surgeons were correcting deformities in children. Today, orthopedic surgeons do a variety of surgical procedures for any condition associated with the musculoskeletal system. For me, I'm a hip and knee specialist, so I do procedures associated with conditions of the hip and the knee. These may be arthritic conditions such as osteoarthritis or even sports injuries such as an ACL rupture or a meniscus injury. A typical day for me starts at somewhere between 7 to 7:30 a.m. where I do my ward rounds to see my patients who are admitted under my name in the ward. Subsequently, at about 7:30, the department has teaching rounds. These are meant to educate the junior members of the department. Following on from that, I either go to the operating theatre where I partake in surgery that has already been listed, prior scheduled, or emergency surgery. A typical day might end at 5 or sometimes even longer than that if the surgeries tend to overrun or become complicated. I also spend about once a week doing research. These tend to be related to surgical techniques or procedures or innovative projects to improve patient care. One of the most common misconceptions I hear from friends and relatives is that, a doctor's life is all work and no play. That's not quite true. Doctors do have a social life outside the normal working hours. We do go out and we socialize with our friends. We do have hobbies that we partake in as well. I always wondered how the body systems work in such harmony and synchrony. I also should mention the strong support of my family in egging me on to pursue my dreams. I think I chose medicine because it gave me the opportunity to put into direct practice the knowledge that I gained to make the life of someone else better. My pathway to medicine started about 11 years ago when I graduated from a local university. Following that, I did my 1 year of house officership, and then I spent 6 months as a medical officer before going back to serve my national service. Following that, I started my orthopedic training, which is a 6-year arduous journey, peppered with apprenticeships, hands-on training, acquisition of theoretical knowledge from textbooks and didactic lectures, which culminates in the exit examinations where a surgeon exits from training to becoming a full-fledged independent surgeon. So for the past 2 years, I've completed my exit examinations and functioning as an associate consultant orthopedic surgeon at Sengkang General Hospital, and I'm glad for what I'm doing today. Skills. A lot of focus is on the science of medicine, pick up the knowledge, the skills needed to be an orthopedic surgeon. The art of medicine cannot be downplayed. Resilience, as you're bound to encounter complications, empathy to be able to think from the patient's perspective, very good communication skills. I'm quite lucky that I'm able to speak 3 main languages in Singapore. Auntie ni hao ma, ni da tika da tong semayang. Apa khabar makcik? Awak punya luntuk macam mana? This has really helped me a lot as I see patients from various backgrounds and building rapport with them.
Can you describe your job in 3 words?
Exhilarating, challenging, exciting.
What's your favourite doctor series TV show?
Grey's Anatomy.
What is your favourite bone?
Favorite bone? The femur.
Do you know any bone jokes?
Have you heard the one about the humerus? That's really bad. Advice.
Medicine is a very competitive specialty, not just in Singapore, but across the world. Students must be prepared to face early disappointments as they apply for medical school and try again and again should their passion bring them there. My advice to youth who want to enter a healthcare profession would be to have a broad mind and perspective. Healthcare as we know today does not just consist of doctors. There are many other critical components or players in the healthcare setup, as we found out from the recent fight against the COVID pandemic, which is still ongoing. Every small bit plays a critical part in saving a life.